Good afternoon, Madam Chair and committee members. Welcome everyone to this afternoon's Housing and Homelessness Advisory Committee. It is just 1 o'clock, Madam Chair. I do know that Councillor Neil should be joining us soon. Is it all right if we give him a couple minutes to see if he can join us before we get started?
Yes, I think we probably should. I'm wondering if we do have quorum for the meeting.
We're currently just at quorum. If Ms. Smith was able to turn on her camera, we'd be able to confirm quorum, but perhaps it would be advisable just to wait a couple minutes to see if Councillor Neil can join us.
Absolutely, sure. Let's give it a couple minutes.
I do have to leave at 2 o'clock, so hopefully we'll have enough people to continue.
Perfect. Okay. Welcome, everybody. Thank you for being at this special meeting today. We'll get right to it. I will call the meeting to order. And as I mentioned, it is a special meeting that we've called. We'll move over to approval of the agenda. So we do have an addendum.
Sorry, Madam Chair, I apologize for interrupting. If I could just briefly run through who's currently in the meeting, just for the members of the public who may be watching at home, so that everyone knows who is supporting us through staff this afternoon. Thank you very much. So Madam Chair, I will confirm that we do have quorum, and we have received regrets from Councillor Doherty, Peter Clark, and Francesca Crete. Joining us this afternoon is Ruth Nordegraff, Director, Housing and Social Services, Mitchell Grange, Manager, Housing and Homelessness, Joanne Boris, Housing Program Administrator, Sarah Lagasse, Program Integrity Officer, Mohammed Hassan, Equity, Diversity and Inclusion Manager, and Julia McCarty-Jansman is joining us as host. I'm Elizabeth Fawcett as the committee clerk. We also have Tracy Flaherty-Wilmot, Associate Director of Org Code Consulting, Inc., who will be here to present to the committee during the briefing. And there are currently 8 members of the public joining us on this call. And with that, Madam Chair, I'll turn it back over to you. Thank you.
Thank you. And sorry, I hadn't thought of allowing you to do that right there. I'm sorry about that. So we'll move back over to approval of the agenda. We do have an addendum to be added. Some correspondence was received this morning. So we'll make note of that as that's added to the agenda. And I would also like to add myself to the agenda under other business to provide an announcement to the committee regarding the next regular meeting of the Housing and Homelessness Advisory Committee on September 9th. So with that, is there anyone else who would like to add to the agenda? Good. Can I get a first for approval of the agenda? I see both Mrs. Smith and Mr. Neil have raised their hands. So Mrs. Smith, can we go with you as a first and Councillor Neil with you as second? Thank you. And all in favor, please. Thank you. So that passes. So we'll move into confirmation of minutes. There are no minutes to be confirmed until the next meeting. Disclosure of pecuniary interest. Is there any from anyone on committee? Good, seeing none, we'll move forward. Delegations, there are no delegations for this meeting. So we're going to move into briefings, and I just want to note that the presenter has been granted some additional time to do their presentation, as it is the bulk. And I just want to note right away that following the briefing, the committee members will have the opportunity to ask questions. And then following that, we'll move into the business item. And as regular procedure, following the business item, again, committee members will have the opportunity to ask questions. And following the committee members asking questions, we will then move over to anyone in the public who is with us who might have questions. They would have the opportunity to speak for 5 minutes, and all questions will be answered at the end of the public questions/comments following that. So we'll move over into briefings now. With us today, we have Tracy Flaherty-Wilmot, Associate Director of Org Code Consulting, Inc., and she's present to speak to the committee regarding the homelessness system review.
So hi, everybody. Greetings from Halifax today. I'm happy to be with you. Thank you, Madam Chair, and the committee members for giving us an opportunity to actually look at some of the work that we've been doing related to a system review. And as you can see here in front of you, our quest is to actually assist the City of Kingston as the service manager for housing and homelessness to look at enhancing the housing and homelessness service system performance throughout Kingston and Frontenac. If we could go to the next slide, just real quick, and I'm actually going to assist in terms of getting us through this presentation. I know some of the presentation slides, or potentially all of them, have been shared, but I will actually very quickly go through them just to keep within our 30 minutes. So those of you who aren't familiar with Org Code Consulting, we are indeed a small Canadian consulting company. We work with about 200 different communities across North America every year. And our home base is actually in Oakville, Ontario. And there's a very small team of Org Code team members. There's only 4 of us that actually work full-time. So happy to be joining you. We can move on to the next slide. So in terms of just a real quick overview as to the goal of this current project, first and foremost, we really want to optimize some of the qualitative work that's happened so far, just to really look at what the information was related to local demands for services, what resources and investments were available. So really looking at some of the work that would have been completed by Insight Consulting and some other reports as well that were much more qualitative in nature. We also want to ensure that we're providing a catalyst for community action. We want to help the City of Kingston establish bold and actionable recommendation that's really designed to align service delivery and engagement strategies so that they're actually in keeping with evidence-informed practices related to preventing and ending homelessness. So our focus was primarily on providing a quantitative as well as a fidelity-based assessment of your current investments, your programs, your resources available to support people who are experiencing housing crisis and homelessness in Kingston and Frontenac. Move on to the next slide. In terms of what we've completed to date, so a real quick overview, we have done a complete review of the service landscape, both data and document review. We've analyzed 7 years of HIFIS data, which covers over 22,000 records. We've also completed fidelity to practice reviews for prevention and diversion, shelter, day services, rapid rehousing, and housing first. And these fidelity reviews have actually been completed either remotely or also in person. We've had interviews with 63 service providers. We've had discussions with 42 people with lived and living experience. We also have the results of a community survey that incorporated, as of 3 days ago, 78 responses. Of those respondents, 85% of them were housed. 15% of those survey respondents were actually living the experience of housing instability and or homelessness. In addition to that, we've also been attached to 8 separate agency-based meetings and case conferences and had weekly sessions with the City of Kingston team. So you move on forward there. So in terms of some of the results of the survey and the interviews, when we think about what has actually been revealed as part of the survey, there's a number of things. We're going to very quickly go through some of these slides just because of time constraints. So as we look at the very first one, there's an acknowledgement throughout Kingston and Frontenac that community members recognize that it appears as if homelessness has indeed increased, certainly become more visible. And the belief is also that available services cannot currently meet the local needs. And that was 87% of the local population that responded to the community survey. In your next slide here, you're going to recognize a couple of key themes that continue to come up over and over again in the responses to our questions and to our surveys. First and foremost, the greatest challenge that's identified as facing people who are experiencing homelessness throughout the city of Kingston and Frontenac County is actually the lack of affordable and appropriate housing, with 73% of all respondents identifying this as the key challenge. In your next slide here, when we kind of look at what are the perceptions of how people in Kingston Frontenac view the current success of housing and homelessness services in terms of meeting the need, you're going to recognize here that in terms of perceptions, there's a belief out there that they're not currently, those services and supports are not currently achieving the success that people would like them to achieve. And you will see this whether we're looking at homelessness prevention, whether we're looking at ending homelessness for people that are experiencing sheltered or unsheltered homelessness. In our next slide here, as we sort of think once again about those biggest barriers, you're going to see replicated here again that the vast majority of people are, in fact, evidence informed when it looks at the biggest barriers that are facing people currently experiencing homelessness, with the lack of affordable housing being the top barrier throughout Kingston and Frontenac. Followed very closely after that is the lack of rental assistance funds, as well as this concern around the lack of support services, whether it's related to harm reduction, mental wellness issues, primary health concerns, or addiction services. In our next slide, when we kind of look at top priorities, again, this common theme, we have over almost 55% of your representatives throughout the community who continue to identify that the biggest priority has to be increasing the supply of affordable housing, followed very quickly behind that with increasing permanent supportive housing options for people who need it. We also have things like the need for additional rent supplements, and then again, the addition of support services related to behavioral health, physical health, compromised mental wellness. The next slide here really kind of looks at beyond people's perceptions. What are we seeing? What are we hearing in community? We really wanted to look into the data. What is your current data that's readily available actually telling you about your system performance? So this next slide here will actually assist you in understanding what are we learning from our point in time count. So an acknowledgement being that these point in time counts will only examine the minimum number of people that are experiencing homelessness at a particular day or a particular period within this point in time count period. And we're using 2018 data. So as you kind of look at where Kingston fits, and this, how many people throughout Kingston Frontenac are experiencing homelessness on any particular day per 100,000 people, we're seeing a higher than expected homelessness rate for Kingston Frontenac. So the next sort of similar jurisdiction to you would actually be Brantford, which is experiencing 100 people of experiencing homelessness within 100,000 people. If we move to the next slide here, what we can see from your Built for Zero Canada work that's happening and your enhancements in your coordinated access, there's an acknowledgement that your coordinated access is indeed doing very difficult work, but really getting an understanding as to what's happening within your community. An acknowledgement here that your geographic coverage, the focus and the resources that are being put into connecting with people and getting them tied to the by name list is indeed working. You're seeing a higher population of people who are experiencing homelessness that are actually connected to your Built for Zero, your by name list, your coordinated access program. If we move on to the next slide here, there's a number of slides here that really just talk about your Built for Zero. And this particular screen and the next couple will actually just look at over the last year. What we have to be aware of is during the pandemic, of course, life changed dramatically, both for people within our communities, but also for service delivery. And so as you can see here, active homeless, the number of people that were experiencing homelessness remained constant, becoming really important to remind ourselves that as we look at our Built for Zero data, we know that in terms of the number of people that were experiencing chronic homelessness as of July 2021, we had 446 people that actually moved in to housing from homelessness. In the next slide here, it's again going to talk a little bit about how many people are actually experiencing homelessness that have indeed been rehoused. So this kind of takes into that number of people that are experiencing chronic homelessness as well as veteran homelessness. So 455 people have been housed since September of 2020. Really remarkable, given, of course, the number of challenges that communities have actually experienced. So moving forward on our next slide here, and of course, probably also courtesy of moratoriums on evictions, we actually had quite a few people that were returning to homelessness after being rehoused. But the 12-month median was 2 people returning from housing, returning to homelessness. Next slide. When we sort of think about measuring system performance, there's quite a bit of things that we're going to be looking at. And this is where these 22,000 plus records come into effect. On the very next slide, beyond sort of this system inflow, outflow, there's really 3 primary metrics that prove to be the most important. We want to find out how long are people spending in the experience of homelessness. So that means, are we actually efficient in the work that we do? How many people are moving into housing? So are we effective? And how many people are returning to homelessness? Have we been successful in enduring that end to their homelessness, or are they coming back into our homeless response system? Our next slide here, when we sort of think about who has been served, an acknowledgement that the database we received just last week, we looked at data of those 22,000 records. This data came from 2014 all the way up to 2021. Of those 22,000 plus records, we could actually deduplicate that information, and we had 5,446 unique households that were actually supported in addressing their housing precarity and or homelessness. In the next slide, however, we start to see that there's a bit of a challenge. So beyond these 5,400 households that were supported, we have to acknowledge that a small percentage, in fact, only 9% of all the people that are served, are using the bulk of the homelessness and rehousing responses in your community. So if we sort of think about this, 489 households were using 34% of all of the services, all the resources, and they were going from being served by multiple different agencies, either 10 times up to a maximum of 48 times. So an acknowledgement being that these 500 households are likely not receiving the depth or the intensity or the financial supports that they're requiring, and they're in this cycle of returning to homelessness. Let's shift to the next slide here. When we think about, are we effective in ending homelessness? So what we're actually looking for here is that for every service that's actually funded, we want to know what is the destination of that client who received the funded service. Unfortunately, when we look at our HIFIS data, only about 12% of the people that were supported actually had their exit destination recorded within that data system. So when you think about all those folks that were supported through prevention or diversion or shelter or anything else, 88% of all those that were served actually had a blank when it came to us understanding where the majority of their destinations were when they exited that program. And understanding that HIFIS, which is your database, HIFIS data entry actually matters tremendously. The next couple of slides, we're actually going to look at, however, of those exit information data points that we have, what did we learn? First and foremost, when we think about emergency shelter, the number of people that are actually exiting to a housed destination from shelter is roughly 56%. So a little over half of your shelter stayers are successfully being housed. 30% of them are exiting to homelessness, and 15% of them are exiting elsewhere. This may mean that we can't find them. It may mean that they left the community, but currently they've exited somewhere else and we're unsure where that is. In your next slide, we're going to have a look at how did we do when it came to rapid rehousing and housing first. Of those individuals that are connected to housing first, and we're going to learn a little bit more about this later, exits to housing are about 60%. So whether that meant that a referral to rapid rehousing or a housing first program was refused by the client, whether the case managers couldn't find them, whether they're still homeless and they haven't yet been housed, 60% have actually exited to housing, 25% of them exit from that intervention, but they remain homeless. In your next slide here, we're actually looking at whether or not we're effective in preventing homelessness. Now, Kingston was one of the first service manager areas across Ontario to actually dedicate investment directly into prevention and diversion programming as part of your housing and homelessness service system. You're going to see here that that investment is indeed paying off. As we look at homelessness prevention and diversion, our exits from that intervention back to stable housing is 75%. However, there is an opportunity to improve upon that, because as we dig down into the data a little bit more, we'll discover some discrepancies around who's actually being served within prevention and diversion. For street outreach, recognizing that this is oftentimes the first point of contact, exiting from street outreach to permanent housing is 25%. And on to the next screen here, when we're examining all of the individuals that are actually touching our system, so they've had some form of an intake. We have a grand total of the number of those households that actually exit to a positive housing destination upon intake, and they've received this service, is about 58%. So let's move on here now. When we sort of think about efficiency, what we want to figure out is how quickly, from the point of time that we come into contact with people who are experiencing homelessness, how quickly do we actually assist them in returning to a housed state? And so for the most part, we really focus in on emergency shelter, rapid rehousing in particular. And what you're going to see here for the most part is that as we sort of examine this, emergency shelter is sort of meeting the bar, the expected criteria around how quickly people return to a house state. Now, we must be aware of the fact that the Integrated Care Hub, ICH, is currently not included in this. So as we look at shelter, on average, 34 days from admission to shelter to a positive housing exit. When we think about rapid rehousing and housing first, the amount of time that people stay homeless after a referral to rapid rehousing or housing first is much longer than we would need it to be. And so we'll talk about that in just a few minutes. So let's move on to the next slide. When we sort of think about this enduring and ending homelessness. There's an acknowledgement here that about a half, and we're only looking at the data from July of 2020 to July of 2021 here, in terms of how many people actually return to homelessness after they've been housed. And so an acknowledgement being that we have some work to do in this. So about half of everyone who's currently served by shelter or outreach actually returned to homelessness. Unfortunately, the same thing is true for your rehousing programs. In the last year, about 50% of the people that were newly housed were actually returning to homelessness. And an interesting point about this, which will certainly come up later, is the recognition that since early of 2020, rapid rehousing and housing first programs have had no rent supplements attached to them, which is certainly not in alignment with evidence-informed practice related to housing first programming. So let's move on to the next slide here. When we kind of think about key insights, and whoever's sort of controlling the PowerPoint, just to let you know, I'm going to go through some of these really, really quickly. So let's move into successes and challenges. And I want to try to focus in on some of the key points here. There's an acknowledgement that the increased community representation that's at advisory committee levels and leadership and system review committees has been hugely important in terms of the inclusion of diverse experiences and voices, and really working to ensure that housing as a basic human right and the importance of trauma-informed care has been in the spotlight. So that's extremely important. When we go to the next slide here, what we're going to recognize, however, is that it becomes really, really important as we're looking at housing and homelessness service system, that we do not lose sight of our goal. And so when we sort of think about the city of Kingston and the multitude of portfolios and services that they're providing, we have to acknowledge that the city can indeed use its influence. It can leverage and try to have an impact on a multitude of issues that are impacting citizens. However, the housing and homelessness service system must stay laser focused on preventing and ending homelessness. And when we talk about mission creep, what we're talking about here is that as we sort of look at system recommendations matrix, an acknowledgement that all of these issues are indeed important. However, when we start to get moving towards things like addressing income inequities and ensuring that abstinence-based programming is available for all people at all times, there's an acknowledgement being that we're kind of moving into areas that are outside of the locus of control of your housing and homelessness portfolio. So really ensuring that the system itself stays focused on what it has control over, and the city of Kingston to really optimize that opportunity for collective impact. But please don't get distracted with all these important issues, but we really need to focus in on how do we improve this system performance. Moving on, we've got prevention and diversion. Let's be really clear. First and foremost, when we look at the data, 13% of those who are served in prevention and diversion programming later experience homelessness. This particular data is so amazing that it actually calls into question some things about who are we actually serving. We recognize that over the last few years, there's been increased flexibility around homelessness prevention funding and how it can be used. So we know it's having the impact on helping households stabilize and with positive housing outcomes. There is the recognition that because this is an investment that you're making, and you started this prior to any other service manager area across Ontario, there's a lot of focus in on it. The other piece that we want to really highlight for prevention and diversion is that your prevention and diversion staff that operate within the In From the Cold shelter is second to none. So that very strong and dedicated focus on housing is actually an example of what every community should be doing. When we move in beyond the success around prevention and diversion and look at actually some of the challenges, so the next slide, please. We want to ensure that we're using prevention funds for the most vulnerable individuals. So the very fact that only 13% of the folks that are served through prevention and diversion later experience homelessness actually tells us that they are likely serving households with lower vulnerability levels when we think about all the research, all the evidence that's out there. We also know that there's plenty of opportunity for a realignment around policies. And one of the key challenges is this scenario where people who are using the discretionary residency benefit, the DRB, may be ineligible for the homelessness prevention fund. This actually can be contributing to your most vulnerable households that are being supported by income support benefits falling through the cracks because they're not receiving the intensity and sort of that depth of support that they would require for prevention and diversion. We also need to be really clear that if your provincial homelessness dollars are actually being used for your discretionary residency benefit, that based in the policy itself, it's currently not being dedicated or doesn't appear to be dedicated as a true homelessness prevention initiative. It aligns much more closely with the old community startup benefit, which was much more like a poverty reduction, which is fabulous, but it's not homelessness prevention. And so targeting of prevention and diversion resources, once again, being recommended. Moving forward, we know that landlord relations are still a primary focus for your rehousing sector. In fact, when we look at all of the housing opportunities that your people who are moving from homelessness back to housing, 71% of them are actually relying on private market rentals. If you move to the next slide, we will recognize that vacancy rates and the number of so-called available rental units for Kingston area has improved. You're now in that healthy vacancy rate. However, the next slide actually starts to generate some of the problem. We know that this permanent housing destination is primarily for your people that your rehousing services are working with. Rental apartments at market price is the primary way that they're finding access to housing, not supportive housing, not rent geared to income, not attached to rent supplements. They are reliant on rental units, private market, market price. Let's move on to the next slide. You'll see exactly the breakdown. So you'll be able to see this in your slide deck, but let's move forward there to the next slide. Here's your big challenge. Market price is not sustainable for your lowest income households. So if we compare the cost of people who are relying on shelter allowance for Ontario Works or Ontario Disability Support Program, you can immediately see the difference per household. People, for example, single adults receiving the shelter benefit, a maximum allowance in Ontario Works of $390. If they're on ODSP, a maximum allowance of $497, but your average rent is $871. So without rent supplements, without rental assistance to those individuals that are leaving homelessness and returning to housing, the likelihood of them being able to stay housed is minimal. And in fact, if we look at the recognition that the rent supplement money that was available for rapid rehousing and housing first programs have actually not been replenished since early 2020, every single household that has currently been referred to rapid rehousing and housing first has zero rent supplement attached to it. They're likely reliant on Ontario Works or ODSP. This is not sustainable. Currently with the City of Kingston, your current investment in rent supplements is representing less than 1/4 of what other service managers are investing for rent supplements for rehousing programs. So this is certainly a huge issue. Those rapid rehousing and housing first clients, I believe there might be 40 of them that are currently receiving rent supplements. These will disappear as of 2024. So you will have an additional 40 households that will no longer be able to remain housed. Moving forward, when we think about our shelter options, one thing that has seen a certain level of success is that due to COVID and emergency response monies, your shelter options have actually increased locally. So you've gone from about 43 shelter spaces to now, with the addition of approximately 40 to 50 people that are being supported in the rest pods at the integrated care hub on a nightly basis, you're moving to about 85 spaces. So you certainly need to be applauded locally for ensuring that there's alternative shelter options during the pandemic. So this addition of roughly $1.2 million is really ensuring that every night people who are unsheltered and have no other safe place to be, there's about 50 people per night that are being supported at the integrated care home. As we move forward, let's have a look at the next slide here. Let's look at the investment in homelessness responses per capita. So as we sort of look at what is the shelter and the outreach investment, this is your immediate homelessness response, and we compare it to other Ontario municipalities. Reminder, it's just a per capita basis. So prior to the investment from the Social Services Relief Fund for the Integrated Care Hub and the addition of 50 rest pods for people who were unsheltered, your per capita response for shelter amounted to $9.13. With the additional SURF funds for the Integrated Care Hub, you're up to $16.57 just for shelter. Problem with this is you compare it to the other municipalities where data was readily available. It is much higher than expected given your population. And certainly once the SURF funds disappear in December of 2021, this will not be sustainable moving forward. Your outreach investment, however, is much less than what other communities are investing for outreach. So let's move on to the next slide. This actually provides us with just a real understanding of what this shelter investment actually looks like. So you're going to start to see here, I've highlighted Kingston-Frontenac. I've used the annual investment for shelter based on 2020, 2021. So this incorporates the integrated care hub and the 50 additional rest pods there. So roughly 85 within your entire catchment area for shelter spaces. Your investment, as I talked about before, $16.57 per resident throughout Kingston-Frontenac. Much higher, even higher than Peterborough, which was something I never thought I would be able to say. So when we kind of look at investment, ideally, we would be looking at an investment per resident that's in the moderate range. Normally, that would mean between $5 and $10. So we've got a little ways to go. In 2018, Kingston-Frontenac was actually in that moderate investment per resident in their community. When we think about shelter beds, your ability to respond to homelessness, you're going to see here that you're actually in the very low range and realistically not sustainable given the number of people that are currently experiencing homelessness and your lack of rent supplements for those that are moving back to a housed state. So let's move on to the next slide. Success. The introduction of the integrated care hub. Harm reduction is in every fabric of how the integrated care hub and the HIV/AIDS regional services does its work. They value and live compassion, empathy, harm reduction, solidarity, social justice. There's always supply access, whether it's for harm reduction, safer injection. We know that the supervised site is there as well. every single guest that we connected with, and we actually spent a day there, every guest during the site visit was either already housed, so they weren't actually experiencing homelessness, and those that were experiencing homelessness, they certainly wanted to be housed. At the same time, many of them spoke about the need to receive support, and also that support needed to include financial support. Moving on to our shelter system, and another success is the housing focus that's really evident in the In From the Cold operations. So as we sort of think about what this looks like, this shelter sees a return to housing as the primary aim of their work. They have a very strong prevention and diversion emphasis. They've got clear messages. They know what this needs to look like. There is a recognition, however, that there's quite a difference in how they deliver services than from the integrated care hub. So let's move on to the next slide. A couple of things to be really clear of in terms of pressure points. Misperceptions around shelter realities. There's an understanding that from the cold, community perception seems to be that they're creaming. They're only taking those folks that they want to work with. It was very evident for Orco that the selection of who's coming in is really based on the client's housing interest. Everyone that's there, it's working on a housing plan. And that the acuity levels, so the depth of need of the people that they're serving, are indeed moderate depth of need. Would we like to see a higher depth of need to actually be served and to have this housing focus? Of course, but an acknowledgement that the perceptions out in the community that only low acuity guests were welcome and served certainly proved to be incorrect. Next. The biggest challenge for your shelter system is that they are currently not operating as a system. So there's an acknowledgement that each one of them are striving to do the best that they can within their own silo. However, you have one that's hyper-focused on harm reduction and doesn't actually consider themselves a shelter and doesn't really see themselves as being able to deliver housing assistance. And you have the other one that's hyper-focused on housing and striving to align to be housing focused. They're both commendable, but instead of seeing them as better or worse, we actually need to see them as complementary. So how can we learn from one another? The co-planning and the co-delivery of shelter services has to become a common aim moving forward. Moving forward to our next slide. When we look at rehousing programs, your rapid rehousing and housing first continue to actually maintain fidelity to practice for those clients that are indeed housed. The biggest challenge that you're going to see, and you'll certainly see this, I believe, in the next slide, is the recognition that the vast majority of the referrals that are being made to rapid rehousing and housing first are remaining homeless for way too long. So an acknowledgement here that housing first as a program intervention is only optimized when supports can be provided to the client from the safety and dignity of home. So many of the clients that are currently on case managers' caseloads remain stuck in homelessness. Many different issues coming into effect in that regard, but the biggest one being the lack of affordability around housing options. And so we need to figure out how do we increase the sustainability and the availability of supportive housing options for highly vulnerable people. Without that, including rent supplements, your current investments will never be optimized. Moving forward. When we think about your success, the amazing work that is happening around capitalizing on things like the Rapid Housing Initiative, the $7.4 million announced in July of 2021, with the 2020 announcements related to affordable and cooperative housing at Wright Crescent and Princess Street and all the others. An acknowledgement being that the City of Kingston, as the service manager, has indeed really focused in on increasing affordable and supportive housing. This work, however, must continue. And it also has to ensure that we're paying particular attention to the lowest income households, and in particular, those that are currently experiencing homelessness. The vast majority of the material that I could find from Kingston about these particular new projects talk primarily about at risk of homelessness. And so an acknowledgement here that homelessness has to be incorporated as a priority area for all community housing and affordable housing and supportive housing. Moving forward. And this relates to this silo. So as we think about community housing, don't just think about social housing, rent geared to income. It also incorporates rent supplements, whether those are portable or location-based. It also incorporates affordable housing. For the most part, across Ontario, community housing is not the primary way in which people experiencing homelessness find their way back to housing, even though they tend to have the lowest level of incomes, they're highly vulnerable. We need to ensure that this silo between the homelessness response and community housing disappears. Some of the ways of doing that is making sure that in terms of accessing these supports, that people actually have an opportunity to have a homelessness priority. And I know the City of Kingston staff are currently working on that. Just like you have a special priority population as it relates to women and families who are fleeing violence. The same thing needs to happen for your highly vulnerable individuals and households that are experiencing homelessness. Moving on. Realistically, there's key recommendations that have come out. Many of those recommendations I have already shared with you. There's 8 slides that actually talk about those recommendations that become very specific about how you can make the most of the investments that you have. I know that our time is probably up, but let me know when you need me to stop, Madam Chair. These are likely in your slide deck. Oh, okay, thank you. So let's have a quick look at these recommendations. First and foremost, ensuring that from a service manager lens, affordable community supportive housing developments actually are dedicated as well to people that are currently experiencing homelessness and are moving back to housing stability. When we sort of think about this number one challenge, number one barrier, the lack of affordable and appropriate housing options are key. The homelessness priority for all community housing investments, also really, really important. An acknowledgement that without rent supplements dedicated to your Housing First and rapid rehousing programs, your ability to successfully end chronic homelessness, it will never be achieved. And so dedicating rent supplements for this particular program and for these clients will be essential moving forward. And that actually talks about, in addition to that, for those clients that are currently receiving investment in affordable housing rent supplements, so for those 40 households that are currently receiving rent supplements through their Housing First and rapid rehousing programs, transferring those rent supplements into the regular permanent portable housing benefits via the service manager will be essential for their long-term housing stability. Moving forward, supportive and supported, including transitional housing options, have to be enhanced. So an acknowledgement that as you look at system inflow and system outflow, there's a small percentage of your overall households, about 9%, that are receiving the vast majority of all your housing and your homelessness resources and investments. We have to really target how do we provide a level of support that actually matches their needs. And so as we sort of think about this, some recommendations, and this certainly comes from the insights gleaned by the work that's happening at the Integrated Care Hub and the benefit of really looking at how can we serve a highly vulnerable population, not just in a shelter or a homelessness scenario, but from a housed scenario. So looking forward, recommending that Kingston consider looking at supportive housing within a congregate setting with on-site 24/7 supports. And if that's not possible, really looking at a scattered site housing first program with lower case management to program participant ratios. And ideally, this could actually intentionally focus in on providing support to people who are compulsively, chronically, or chaotically using alcohol or other drugs and experiencing long-term chronic homelessness. And of course, for that, not only community support, but also public health and city council endorsement should be sought for that. Moving forward, coordinated access. So you have a long history of coordinated access in Kingston-Frontenac. It's working very well. There's an acknowledgement that in terms of getting people onto the by name prioritization list, the assessment teams are doing fairly well. We learned an awful lot during 2021 with some of the pilot initiatives that that team did, having drop-in hours where people who may be transient, who may be unsheltered, that they know that they could come to do an assessment, specific days, specific times, worked well. We encourage people to do that. The other piece, of course, is this acknowledgement that the more agencies, services, and programs that are taking people off that list in order to fill their housing and support program vacancies, the better. So including in that by name list, not just homelessness and rehousing services, but also housing programs that may be funded by health, that may be funded by the justice system, incorporating those into that coordinated access process becoming really important. And doing a better job in terms of formalizing the centralized waiting list activities and the by name list so that nobody actually gets taken off that centralized waiting list for social and community housing until we've tracked them down primarily through the housing and homelessness response system. Into our next slide here. Prevention and diversion. Talked about this. Targeting of these resources will be really, really important. We acknowledge the fact that in terms of the integrated care hub, it is indeed a big investment, and acknowledgement that if there was a dedicated prevention and diversion worker, or ideally workers, who could actually do this dedicated housing assistance and rapid exit out of homelessness embedded within the integrated care hub, that would greatly enhance housing outcomes. We also talked before about the connection between discretionary residency benefits and homelessness prevention fund, an acknowledgement that as much as we would, people would benefit from additional dollars, if it's not actually targeting the most vulnerable households that will likely become homeless if we don't intervene, we have to acknowledge that your finite CHIPPY dollars, your provincial dollars for homelessness prevention, cannot be used as a poverty reduction benefit. It has to be targeted. Next slide. Impactful outreach. So currently your home-based housing outreach services are very, very busy responding to the encampment protocol. Our key quest will always be that in order for outreach services to be as effective as they possibly can be, they must operate as a connector to the housing system itself. And so our hope would be that they're able to return to that. They're the key first point of contact to get people either connected to shelter, get connected to the prioritization list, to get them moving towards a rehousing plan. And our hope would be that with the other outreach teams that are actually operating, whether they're faith-based community volunteers, whether they're health-funded outreach teams, that those other teams actually focus in on ensuring that people who are unsheltered have basic needs and have harm reduction supplies provided. But the outreach services through home-based housing truly focus in as a connection to permanent housing solutions. Next slide. Shelter system enhancement. So just some understanding, there has to be continued focus on low barrier housing focused approaches. Cross-training between In From the Cold and Integrated Care Hub would be amazing to really identify how this type of sheltering can be done and still maintain housing focused approaches. There's an understanding that your demand for housing focused shelter services far exceeds the current capacity. And so we need to amplify that approach to service delivery. We're certainly recommending joint planning process with shelter management, frontline shelter staff, former shelter users in the city to co-create a vision for the shelter system and ensure that this sector has shared values, shared mandates, shared activities so that there's consistency. In the interim, the addition of workers within the Integrated Care Hub as part of that service delivery to provide prevention, diversion, and housing navigation was identified as mandatory. Currently, even though housing assistance is indeed identified as part of the Integrated Care Hub activities, housing assistance delivered on site is minimal. So we need to enhance that. Next slide. Rehousing programs. So just a reiteration here, it has to be acknowledged that operating housing first and rapid rehousing programs without rent supplements is not evidence informed and is certainly not sustainable. So if you want to optimize that case management investment, which is indeed an appropriate investment, we have to ensure that rehoused clients and clients who are trying to navigate back to housing actually have access to the rental assistance and the subsidies that they need just to be competitive for your available units. The other thing that we have to be aware of as well is that recognizing there was quite a lot of returns to homelessness, really needing to amplify the eviction prevention efforts for formally supported rapid rehousing and housing first clients if they start to face an eviction. The other components around this, of course, is just this opportunity to do the application of a harm reduction oriented intensive case management using that scattered site or a congregate living setting that we talked about before. But these folks would actually be, moving away from chronic homelessness and a harm reduction approach, and all tied to a binding list. Next slide. Two more. First and foremost, if we want our frontline staff and our partners to be doing this work and doing it well, going to reiterate the 2017 recommendation from that particular operational review that continuous improvement and quality control activities be amplified. So a list of core competencies, a list of minimal training requirements, recommendations around how quality assurance actually takes place. And then the final recommendation on the next slide is really dedicated to enhancing cross-sector collaboration. So an acknowledgement that especially during the pandemic, an awful lot of services and resources either shut down completely or there were no in-home, in-person visits that were happening. And so this acknowledgement that as housing and homelessness service system does its best to collaborate with other sectors, whether it's health, whether it's justice, whether it's child welfare, this collaboration was, further complicated by the global pandemic, but an acknowledgement in particular that when we're looking at both our housed and our homeless individuals that are currently being supported by your housing and homelessness system, one of the biggest things that was identified by every single program was the challenge around cooperation and consistency in the work that housing workers were doing with mental health professionals, especially as they tried to support clients who had community treatment orders, an acknowledgement that, this system level collaboration has to be formalized through either memorandum of understanding or protocols. and wherever you can, to please do multi-service hub models, because they're working really well, where a number of agencies or a number of services are providing support to the people that we have the privilege of working with in our communities throughout Kingston and Frontenac. And that, I believe, is it. Thank you so much, Madam Chair.
Thank you so much. That was a very important and very comprehensive presentation. Thank you for that and for the work involved.
Thank you.
So I will now turn it over to our committee members for questions. And if there are no questions, we'll move over into business. Sorry, Councillor Neal, did you have one now?
Just very quickly, and this is actually a question of our clerk, would we be able to get a copy of the slide deck that we can share? That would be great. Thank you. Thanks a lot.
Were there any other questions from committee members? Okay, so we'll move over into business. So we now have the report of the Chief Administrative Officer, which is attached. And it's a facilitated discussion. Hi there, Mr. Grange.
Thank you, Madam Chair, and through you. Really, the purpose of the special meeting and the report that's in front of you was simply to have what just took place. This is for Tracy, and thank you, Tracy, for your presentation to come to speak to the work that she has been able to compile, the quantitative work that we've been working towards with her over the past several months, to have that facilitated dialogue and discussion with your community members prior to, just to ensure that there's that fulsome dialogue and you have all the information available to you. So then when the plan is to take the information that Tracy presented today and included as part of our draft recommendations that we had already shared on June 10th, and come back to committee on September 9th with a fulsome system review, recommendations and implementation plan. So really the document is just outlining that, and it was really just to have Tracy come today to speak to what she did, which was, as you mentioned, very comprehensive and very informative. So that's the extent of what was written in the report today.
Thank you, Mr. Grange. So I will now call on our committee members who wish to ask a question or to make a comment. Ms. White.
I just kind of a bit sketchy to hear what Mitchell was saying. So is it my understanding that this report that Tracy did and the group, which I find very, very interesting, is the city actually going to adopt all of these recommendations that they have presented? And if so, does the city actually have a timeline for each of these recommendations and an outline of who they will be looking at to work with to achieve these recommendations as well? Thank you.
Thank you, Ms. White. Ruth. Ms. Nordic, thank you. I see your hand.
Yeah, thank you. Thank you so much, Andy, for that question, and through you, Madam Chair. So yeah, and I know Mitch was a bit choppy with this mic, so I think he's trying to figure it out. But we, so yes, as part of the September 9 report to the committee, it will be the final basically list of recommendations, and we are using this information to then have our procurement process with the various elements of the homelessness system with these various recommendations. So for instance, one of the recommendations is, the focus on, for instance, the rent supplements. So we're also at the same time working obviously on our operational budgets, and we're looking at how all of this would fit and what potentially the additional asks should be for specific areas of these recommendations. I will be honest, I cannot speak specifically to all of them in a specific timeline, but the intent of this very both qualitative and quantitative intense review process over the last 6 to 8 months really has been to really look at all the elements, what's going well, what's working well, what's not working well, and how can we use both our procurement of services with the providers that we fund, or everybody that would like to play a role in the homelessness system will have a chance again to help us implement those recommendations. There obviously are a few, and you might recall the June 10th meeting with the big list of recommendations that are pieces that we would do more, that would be more within our own role as a service system manager. So again, the intent of today was really to kind of have an opportunity for the committee to ask any additional questions. Also, if you hear a recommendation that you feel you want to dive deeper in, or you have concerns or ideas, or if there's something missing, this is kind of where we really wanted to open it up for some conversation. And then we are going through the process of the final reports and the procurement process and the timeline. So the intent is to have procurement finalized in 2021, and starting January 1st, have kind of these pieces roll out with our providers.
Thank you. Did that help, Ms. White? You're on mute, but I think.
Yeah, to a point it did. This is the first time I believe we've seen the slides. I would have liked to have been able to have this meeting and then have a meeting in a couple of weeks so that we could actually look at the information a little bit more in depth, so that if anybody does have any ideas or concerns, are able to come together again and present the questions or ideas. It just seems a little bit rushed, because obviously we're all trying to process this report, which, like I say, is a really good one. So I would have liked to have seen that happen, just a couple of weeks, just to go over things, and then all come back together again to see if there's anything else. But I appreciate Ruth's information.
I see 2 hands here, but we'll start with Ms. Nordegraff. I saw hers go up first, and then Mr. Grange.
Apologies for the technology delay here. I will gladly pass it over to Mr. Grange. But again, we do have the September 9th meeting where we would have another opportunity. And in the meantime, again, we welcome any additional questions, concerns, thoughts. So again, to Councillor Neal's request, and I apologize that we were not able to send this in advance, but again, really welcome the opportunity for the committee to use either the time before September 9 or during September 9 to also continue that conversation. And then we would, after that, go to council with a report, which is planned for September 21st. So I know there's lots that is in the works, but there are more opportunities to comment, to share. But we also really wanted to make sure that we keep this process moving, because we all recognize that we need to make some significant changes. And I think, again, the work that Tracy did so far really shows, I think, a lot of the things that we were already identifying in a more, I would say, kind of narrative and kind of the qualitative pieces, and now having that quantitative piece to it as well is very helpful. So I don't know, Mitch, if you would like to add something to that, because I know you've been much more involved in the day-to-day process of this.
Thanks, Ms. Nordegraff, and through you, Madam Chair. First, I'd like to check, is my audio sounding much better?
Yes, it is.
I just really reiterate what Ms. Noordegraaf said. I wanted to make sure it was clear to the committee that the intent of today's meeting was, although it may have felt a bit rushed to have the very comprehensive slide deck put in front of you for today's meeting, but the intent is to kind of digest that, get that shared, and as was mentioned, come back on September 9th to have that final discussion before we go to council on September 21st for the full, for a recommendation report for the full implementation, which will then lead into the procurement process, which will be evaluated and brought back to council in late November or mid-November, I believe, for decisions, which will lead into the new service agreements and a lot of the recommendations mentioned today implemented at the start of the new year with greater accountability held towards our providers. And as indicated earlier again by Ms. Noordegraaf, we will certainly make sure that, and we're in the midst of our budget deliberations to ensure what may be possible come the new year with the funding that we have available for us for servicing. Thank you.
Thank you very much, Ms. Noordegraaf and Mr. Grange. I agree. I think having the fulsome presentation has now equipped me with some more knowledge and resources to be able to read that slide deck with better confidence. So thank you everyone for that. Are there any other questions from committee members? Yes, Councillor Neal.
Thank you. I appreciated in Tracy's presentation, and perhaps either she or Ruth can speak to this, the integrated care hub. It's a really necessary service, but I cringe a little anytime we talk about those beds being counted as the equivalent of homeless shelter beds, because it really is a kind of triage, outpatient kind of service, and they do an enormous amount of good in the community. But I think it's a very different type of thing than a shelter or rent stops or all of those other things. And it's my understanding that many of the people that use those services aren't necessarily homeless, but they have other needs that take them to the integrated care home. And that isn't meant as a criticism of the work that they do, but like I say, I cringe a little when we talk about those beds as being serviceable shelter beds. I see a motivated group, so I look forward to her response.
Thank you. I'm happy to give some of our thoughts on that, Councillor Neal, through you, Madam Chair. And sorry, you were cutting out a little bit sound-wise, so but I think I got the gist of it. I mean, it's a really good question. The Integrated Care Hub is obviously been initiated for a couple of reasons. We are also, and as Tracy pointed out, still under a reality of COVID restrictions and limited capacity in some of our other shelters. And we're really seeing, I think that this is a combination between like a health response, a harm reduction, a safe or consumption treatment services. So I know we're not necessarily counting these the overnight stays at the Integrated Care Hub as shelter. We also really need to understand what the next couple of months will look like with the pandemic, what the requirements will be moving forward. And there definitely are people accessing the integrated care hub that are not necessarily homeless or may not need housing supports. The one thing that we are looking at, and again, kind of back to the presentation, is really looking at how the system works together, and also how kind of ultimately there is a pathway. So if people come, depending on where a client comes in for service, either through street outreach or through the integrated care hub, or even in our Ontario Works office, we just want to make sure that there is a full kind of pathway in place. Of course, the reality is, affordable housing is not always readily available, and that might be an understatement. There's big gaps in the system, and I think some of that we can really kind of control within our role as a service manager, and other pieces are really kind of other agencies, and we're trying to, again, really to find those solutions as well. I feel like I'm going off off a tangent here a little bit, but
It's
I
a complex topic.
Yeah, and I don't want to keep repeating that, because we all know it's about finding solutions and finding ways to have not a one-size-fits-all, but also have the system work together. The integrated care hub was not here 18 months ago. So I think it's taught us a lot. It's shown us a lot of new insights, but it also is really, again, bringing up those really important questions about, barriers, substance use versus not substance use. There's a lot of different pieces that come to that conversation. And the other big reality is, and we are looking at obviously the future of this, but this has been funded, integrated care has mainly been funded through provincial COVID response funding. So we also need to look at not only what is the future going to look like, how does this fit within the bigger system during COVID, post-COVID, but also what's the funding for that, and how does this work? So lots of questions that I will be quite frank, we have not, we as the big, I think, community don't have a perfect answer for at this point, but we're definitely trying to work through that. And I think this system review and really kind of diving deep in the real issues and realities is helpful to then move into a plan moving forward.
My next question actually combines two unrelated things. At council, we're only allowed 2 questions, so we get in the habit of putting things together that don't necessarily belong. But rent subs have proven very, very useful, I know, in other communities, because it kind of, it doesn't leave it up to the municipality totally, and it gives people greater freedom in selecting where they live. And I'm wondering if we're able to enlarge our rent sub portion of our support for helping to rehouse people. And my other question is somewhat unrelated, but I know over the years we have had hotel vouchers for emergency kind of situations. And in the past, those haven't always been used. And it's been a budget line that hasn't been fully utilized as I think it should be. Where do we stand with those motel or hotel vouchers? And is that an area that we could improve the funding so that we get people, particularly in heat waves and blizzards, out of precarious situations?
Please go ahead, Mr. Grange.
Thank you for your question, Councillor Neal, and through you, Madam Chair. The first part of your question, rent supplements, yes, they are extremely effective programs. We have a multitude of rent supplement programs existing currently within the city. The one specifically that was addressed in Tracy's presentation is tied to the investments in affordable housing and provincial funding, which is expired in 2021. So in order to extend the rent supplement portion subsidies for those individuals, we were able to tap into the Canada-Ontario Housing Benefit, the COB programs, what it's called, in order to extend those rent subs for an additional 9 years. We do have the 40 that are expiring in 2024 that are tied to a separate year funding of IAH. But we know now through Tracy's work and through the budget deliberations that are coming up that there is a need to find funding to expand on that programming in order to make the Housing First programming work and be highly effective. And secondly, to your questions around motels, I would say to that, we are using motels to support shelters. The hope is that when the shelters are able to regain full capacity due to the congregate living restrictions that they have in place, that motels may not be needed. However, they are there currently as kind of a fallback plan. And if you look at our Lily's Place, our family shelter system, we have been utilizing a hotel because they have been at capacity for the over the past year to support in that case. We do have an overflow shelter that has opened up to support the shelter capacity. So motels are on our radar. We are using them to some capacity at this point, and there may be an option to use them in the future, but that'll be as part of our deliberations when we look at updating the system come 2021.
Do we use the totality of that budget line? I asked that question because I know in the past we've had that budget line, but sometimes it was hardly utilized at all.
Right, we have been able to access and utilize funding through the Social Services Relief Fund to assist in that for the past year and a half as part of COVID response. So that may be a unique year to look back to see if funding has been utilized for that. But I wouldn't have that answer for you off the top of my head, and we may have to.
And the rent subs we're talking about, they aren't necessarily tied to our existing social housing stock or our own, but we can actually give somebody a rent sub that because they've found a place to live, and the rent sub will allow them to move into that private landlord's property. Does it work that way at all?
Yeah, that's correct. Through the Housing First programming, that would be they would be connected to Housing First case management, and housing liaison worker would assist in finding them private or a location throughout the city where the rent sup would be tied to that. We do have many programs through rent sups that are attached to our social housing through the Housing Services Act as well. But in terms of today's discussion.
So if I qualified for that, given a needs assessment, and I went to housing and said, here's the address, this person will allow me to move in. I need to top up my income in order to afford it. That would work for me?
Yeah, there's certainly some eligibility criteria that would have to be worked through, but yes, that's basically the gist of how that would work, where in support with your Housing First case manager, you would be able to find private.
I think in the immediate future, that may be our strongest way of getting people off the street and into suitable housing. Thank you. I see other hands. I'm sorry it took so much time.
Not to worry. So I've seen Ms. Everett, and then following Ms. Everett, we will go over to Ms. McCarty.
Hi, thank you, Madam Chair. I just wanted to say to Tracy that I really appreciated the presentation, and it was having the information. I learned a lot. There's a lot that's happened over the past year, for sure, especially around the rent supplements. I wasn't aware that there was no longer rent supplements available. And I just wanted to maybe make the comment around the collaboration piece. And I know I brought this up in many groups, but just to ensure that the collaboration, I think that's one of the key things in our community, and that what I hear as well is when there seems to be lots of services available, but the lack of housing certainly was evident in your presentation, and how we can work together to really prioritize those most vulnerable, regardless of which service that they come to first. But I guess for me too, and I didn't see a lot of this, and I'm not sure if this was part of the research or maybe ties into Dr. Marshall's presentation more, but around what are the key reasons that people are losing their housing? Because I think that will tell us a lot, and especially if the city is investing in housing, or if there's opportunity to invest in more supportive transitional housing, what should that housing look like? And I think, so I'm just wondering if in the research, if any of that came out.
So with your permission, Madam Chair, I can respond to that in terms of what we did discover in the research. When you think about 9% of all the people that were served over the 7-year period actually using the most services, most frequent use of services, there's a couple of things to keep in mind. It really leads us to an understanding that supportive housing and rapid rehousing, embedded supports, and transitional living programs become extremely important for at least those 9% of your households that continue to cycle through homelessness. So they're going to need a greater level of intensity and frequency and duration of support. The other piece to kind of think about is that when it comes to affordability, and acknowledgement being that without rent supplements being available to new referrals for Housing First and Rapid Rehousing programs since early 2020, no surprise that so many of those clients that are waiting to be housed, number one, are staying homeless way too long and becoming further entrenched and further vulnerable. But also without the rent supplement, even if they can stay housed, they're unable to stay housed due to affordability. And so as you sort of think about this, we understand from Housing First, and Tara, you're so familiar with this, that Housing First works because you deliver case management supports and these wraparound supports from other agencies from the safety and dignity of home. If clients are unable to move into a home, then higher levels of vulnerability, greater street entrenchment, homelessness entrenchment happens. And so when you sort of think about it, it has to be a focus in on, let's improve affordability, let's improve supportive housing access, improve transitional living access for people who may need to stabilize initially before they can move into more of an independent or private market rental. So it was certainly apparent, and that was also identified by Dr. Marshall as well. I hope that answered your question.
Thank you. Ms. McCarty.
Thank you, Madam Chair. I just have a question about the hotel vouchers that are being used. Where do they come up in the stats in the aspect of, are they recognized as being like a shelter bed temporarily, like an overflow, or are they seen as or counted as an individual being housed?
Madam Chair, if you would, through you. That's a great question, Michelle. We gave or code the information regarding the hotel stays. motel stays, because that information is that when individuals aren't just going to a motel and showing up, they're linked through the shelter system so that it's a housing focused intervention. And then they're attached to case management or prevention diversion to assist them while they're staying in the hotel. So those stats are being implemented and input into the HIFIS system and the by name list by the staff working with individuals. So it is captured within the numbers that you saw over the last year.
Which numbers are they captured under?
If you go back in the slide deck, and I think it's the third slide deck. I'm sorry, I don't remember exactly which
It
one.
was just so fast.
Yeah, there is an overflow line there. So once you have access to those slides, you'll be able to go back and reference that specifically.
Thank you.
Thank you.
Thank you. Are there any other questions from committee members? Okay, if there aren't, then I'm going to ask Ms. Fawcett to help me identify if there are any members of the public who are present. And again, I will note that members of the public can speak up to 5 minutes, and all questions will be answered at the end of the public questions and comments section of this business item.
Thank you, Madam Chair. And through you, I do see that we already have one hand up, but I do want to let you know that we do have 10 members of the public present with us at this time. As well, I want to let everyone know if you wish to speak during this section, we do rely on the raise hand function in Zoom. So if you would like to speak, please raise your hand. The button for that is located in the center of your screen in the Zoom window when you move your mouse over the window. So first to speak, Madam Chair, is Michelle Schwartz.
And I will also just note, because I don't see anybody from the public on my screen, I will count after everybody speaks. I will count on Ms. Fawcett to come back and reintroduce who is to speak next. Thank you. And please go ahead, Ms. Schwartz.
Hello.
Hi.
Sorry, can you hear me?
I could hear that a little better, but we couldn't hear you before that.
Sorry, I did not actually submit a question. I was waiting for somebody else's question.
Okay, is there somebody with you who would like to speak? Is that what you're saying? Sorry.
No, I'm waiting for a question that was submitted online, but I don't actually know how my name came up here.
Okay. Okay. That it was in and out sort of, but I think what you might be referring to is the correspondence that we received, which I will be at the end of all of the public questions. I will be asking those 2 questions on behalf of that correspondence.
Yeah, that's good.
Perfect. Thank you.
Thank you, Madam Chair. Through you, I do not see any further hands at this time. Perhaps we could just do one last call for hands. And I do see Laura Moberly has her hand raised.
Thank you. Please go ahead.
Hello, do you hear me?
Yes, I do.
Okay. Hi, my name is Claire, and I'm wanting to actually start a supportive community, especially for the neurodivergent, using potentially alternative housing methods to keep it affordable, sustainable, and I have potential ideas to put for it to be able to generate wealth for the residents that live there, great jobs. Who do I just messaged Paige Agnew this morning with more of my ideas about it, and potentially who I can connect with. I also just messaged Jim Neal because he's my local counselor as well. And I'm wondering how I can go about potentially getting this started.
Mr. Grange, please go ahead.
Thank you for the question or the comment, and through you, Madam Chair. I would say that we would certainly be open to having discussions offline if your initial questions wanted to go through Councillor Neal to myself or directly to myself. We'd be happy to have those discussions. So I'm not sure. Maybe through Paige or to Councillor Neal, as I indicated, could come through to my email, but I'd be happy to kind of take the initial communication on your proposal and have that discussion.
Okay, thank you.
Thank you, Claire.
Madam Chair, we do have another hand, and I believe this one might be Laura Mobley at this time. So I'm going to ask her to unmute.
Yes. Hello?
Hi there.
Hi. So I have a question about the 48-hour encampment evictions policy that's been in place for the last few months, in which anyone who is found camping, bylaw comes and gives them roughly 48 hours notice, and then they are evicted from that space. In many cases, people have reported that when they are evicted, it's just a bylaw officer there. There is no presence of anyone from home-based housing or any other organizations offering additional support. And members of the community end up actually losing a lot of their possessions. Basically anything that they can't remove with them by hand is either destroyed or taken somewhere, and people don't seem to have access to then reclaim those possessions later on. So this is causing a lot of stress and trauma to people that are already in very precarious situations. A lot of people in the homeless community, when they're given notice of an eviction, simply end up feeling like they have to move farther back into wooded areas that are less visible, and that takes them farther away from access to services and care. So I'm wondering, how does this 48-hour eviction policy benefit unhoused people rather than simply being a way for the city to make them less visible to the public? Thank you.
Mr. Grange and Ms. Nordergraff.
Thank you for the question. I could certainly jump in and speak a bit to the protocol and the question or the concern around personal items or the lack of support from our community partners. Certainly, the expectation and what we are seeing is that street outreach or funded services are out in the field every single day. With outreach to individuals who may be camping, and that's in support with bylaw on municipal and private lands. So there is daily outreach happening. So if there is a need for someone to be asked to move along, we are currently working on a storage policy that would help to ensure that their belongings would be stored in a safe and secure location. And we do have an internal interdepartmental city working group that are in collaboration with ourselves at Housing and Social Services and bylaw and police, public works, many other departments, to have those discussions to ensure that we are staying on top of trends or possible ways to build upon the encampment to support those individuals, as well as working on storage policy. So I'm not sure Director Nordergraff had her hand up if she wanted to add to that, but just speaking to kind of the policy and procedures of how that would look, we are working through that that piece. So thank you.
Thank you, and for you, Madam Chair, just to quickly add to that, the encampment protocol was established earlier this year in April, and Council finalized or approved the protocol as proposed. Prior to that, there was no real protocol for encampments, so it did give various partners involved more direction on kind of steps and procedures. We also have the ability, and again, to Mr. Grange's points, like we are, obviously going through this protocol, working through this, seeing kind of obviously the challenges. I will say the reality is the encampment protocol was not set up to solve homelessness or solve encampments. It was really to identify a procedure. I think the bigger question obviously is we do need to come up with, as a community, solutions for people that are in these situations. So we will be revisiting the protocol and kind of the broader encampment piece. And to Mr. Grange's points, we are bringing forward in, again, the September 9th meeting, an update on the storage policy next steps, because we're hopeful that we'll have a solution actually in place fairly soon. So I know it's a very challenging situation. Also, if there are any specific situations or examples, we're always happy to hear that and bring that back to the encampment working group to mitigate.
Thank you.
Madam Chair, through you, next to speak is Amanda Mallory.
Thank you. Amanda Mallory, you are muted.
Sorry, I'm not sure if you can hear me. I've never used this before at all.
Yes, I hear
It's
you
all
now.
very last minute.
Perfect, we hear you.
Thank you. I apologize. I joined late. I have some cognitive issues too, so you can just sort of bear with me. I struggle a little bit with drawing on my words, especially when I'm not prepared. The homelessness issue is very close to my heart. I have a friend who, through no fault of their own, they actually left a rental that was a short-term 8-month rental. It's a family of 5 with a disabled child, which is, they've been brought through the news to, people are probably well aware of who this family is that I'm speaking of. But just with listening to the counselors speak of the options that are there, the ability to have people housed in motels, that there's overflow for these family shelters. This really is not occurring right now. I can speak from watching this family go through the experience. I would just like to know sort of who, I guess there's a few things here. The hotels that, this family had access to, it was full of bed bugs. It was not clean, especially to just basic standards, let alone during COVID. The city paid for a couple nights and was only willing to pay for rooms in this type of a hotel, not anything that was clean and that anybody in their right mind would be willing to have their children, let alone you and I, move into. There's no way. I mean, I wouldn't personally. And I wouldn't with my family. I wouldn't expect anybody to live in those kinds of conditions. But if these are the kinds of things that the city is claiming that are available, it's not ideal, or it's less than ideal. It's not even, it's not hygienic conditions. I think if they're going to say that there's opportunities for people to have this kind of funding and to be placed because there was no space actually in Lily's place for this family. It was just really unfortunate that that was the option they were given, and that they're now forced to live in a trailer park right now for the summer months, which has now got CAS involved, which has been, it creates a larger picture, and you guys want to know sort of what starts the issues with homelessness. it's not always cut and dry. It's not one thing. It's multiple things often at play here, especially with this family in particular. It's just sort of an example. But who do these people find access to these services through? Because home-based housing is not helping. They basically have given them the runaround. They don't answer them. It's been very unhelpful to them. They're not really pointing them with, giving them any options with viable housing options. If there is some sort of funding, I just heard at the end with, I don't understand, maybe I don't know enough about it, and I apologize if I don't, but that there's some help potentially for people to get into homes that, may be out of their reach. This family is on ODSP with they're receiving income for one parent that's on ODSP. The other parent had to quit working to care for the child that received a brain injury at no fault of her own from surgeries at a hospital outside of our area. So, this family has slipped through the cracks, and there's many others like them. They're not isolated, they're not alone. And I just think if the city's going to talk about these things being there, they need to be accessible to people, and they're not, from our experience, I guess, is my point. So I know there's a lot there that I've said, and I apologize if it's sort of all over. Again, it's my cognitive issues, and I apologize. But I think this really needs to be brought to the forefront, and people to realize that this is happening every single day to people like you and I. It's not just. I'm sorry, I want to be politically correct in how I say things, and I struggle with that with my cognitive issues. It's not a certain group of people. It's everybody that's being affected by this, I guess, is the point. I'm just looking to see, is there actually a system in place that people are accountable for the city services when people are directed and there's no help from them, or when people are slipping through the cracks potentially?
Thank you very much. And Ms. Nordergrath, I see your hand for response.
Thank you. And thank you so much for bringing this situation forward. We are obviously aware of the story, and I recognize that there are many different stories like this, unfortunately. I wish I would be able to give you the perfect answer. And I know that we get many different situations of challenging situations that are created not by I guess what I'm saying is we're definitely aware of a lot of very different stories and very challenging stories that are happening in our community and in every community. I don't have the ability to specifically go and discuss this situation due to privacy, and as a city staff, I can't. I know we're aware of this. I'm happy to, as for the hotel and motel conversation, and I know it came up earlier today as well. Ultimately, our role as a city with our partners is we're trying to find hotels, motels that are willing and able to support clients. And again, it's really important that there is also then the ability to provide services to those clients while they're in the hotels. I know there's been a lot of a lot of questions about this, and a lot of information out there about the different hotels. But we're, as a service manager, always really trying to secure hotels. Not every hotel or motel is willing or open to navigate to supporting clients. And again, it also then really becomes the opportunity. It's also really important for the provider to be able to provide the supports while clients are in the hotel. All that I can say is, again, we're very aware of all these very challenging situations. We know that there are limited housing options and limited services in our community. There definitely are accountability measures in place, and through the different, through the work with our system review, we actually want to add more of those accountability measures. there are various complaint procedures and abilities for us that we want to bring back into the system is more clients, kind of exit surveys, etc. So again, I know I cannot give you the perfect answer on this one, but I think we're all trying the best we can with the services we currently have available, the partners that are both private and not-for-profits that are willing to support. Again, I know this specific situation has been on our, we've received multiple questions about this. We've had multiple conversations as well with our providers to understand the situation. If this needs to be an offline conversation with our partner, I think that's potentially a better way forward. But overall, I just wanted to recognize that we're very aware of some of the very complicated situations and are trying our best to be supporting to the best of our ability.
Thank you very much, Ms. Nordegraaf. And I'll just, if I can, just quickly say to Amanda Mallory, I think you did a perfect job sharing. I know you were worried about that. You spoke about an important issue. And I want to just say to anybody else from the public who's with us today or watches later or anytime, thank you for being here. And I encourage you to speak and ask your questions, share your concerns and your comments. Please do. Yeah. Okay, Ms. Posset.
Thank you, Madam Chair, and through you, we do have 2 more hands raised. However, they are members of the public who have already had a chance to speak and they have some follow-up questions. Before going to those, if you would like, Madam Chair, I do require Councillor Neal to return to his screen very timely. We just need to make sure that everyone remains on screen as we are right at our limit for quorum, just so that the committee is aware of that. So Madam Chair, would you permit follow-up questions?
Yes.
Okay. First to speak for follow-up is Ms. Moberly.
Hi there. Thank you for letting me ask a follow-up question. So this is just in response to Ms. Nordegraaf's and Mr. Grange's response to my earlier question. While the protocol that's in place may state on paper that support services are made available surrounding the evictions, I work directly with unhoused people in the city, and that is not the reality. I've had many cases I've been told about where people are evicted and no one from housing support or other services is reaching out at that time. So this is why people, again, feel like they have to just move farther back into less obvious areas. The bylaw officers seem to be targeting people that are quote unquote less desirable homeless people. So people that are using substances or maybe in mental health crisis and, making a bit more noise, making more of a scene. People that the public may have more of an issue with just because of how visible they are. And these are some of the people that are already dealing with trauma and are really being further traumatized by these evictions. It also makes it so that individuals like myself and charity organizations that are trying to maintain contact and support for people have a much harder time maintaining our communication with them because we don't know where to find people to do our check-ins. The UN Human Rights Coalition last year made recommendations around homeless encampments, saying that they'd be allowed to remain in place during the pandemic. And I feel that this 48-hour eviction policy is in direct conflict with that. So again, I'm wondering how this policy is meant to actually help or support people experiencing homelessness in the city. Thank you.
If I might, thank you, Madam Chair, if I might through you. Thank you so much for that question. There has been a bylaw around camping on municipal land for quite a number of years now. And the current bylaw officers are responding to complaints only at this point in time. So they're not out looking in the bushes or going off track to try and find individuals to move them along. They are working on a complaints-based process. What we can certainly do is take your comments back to that working group that we've established with service partners also, and let them know your thoughts. And we're more than happy to do that at the next encampment meeting. So thank you so much.
Thank you very much.
Madam Chair, there is the second follow-up question, but I also see a new hand raised as well. Would you like to go to the individual who has not had a chance to speak yet, or receive the follow-up question?
Either one is fine with me. I think actually maybe just to continue on with the follow-up question first, and then as they had their hand raised first.
Okay, thank you, Madam Chair. Through you, next to speak is Ms. Mallory.
Thank you very much. I appreciate that. I'll keep it short. I just wanted to say thank you for the response that was given to me and for the patience that I was shown. I also just wanted, it's similar sort of statement as the previous speaker, but in regards to sort of our each individual comments, just that it's frustrating sometimes, you know, hearing that things are available, but when people are actually going through the situations, those services aren't exactly there. And it makes people sort of gun shy to reach out to those services when it causes more stress and headache and aggravation rather than any help when they're already severely distressed. So, you know, if that's where I had asked about the accountability part, but I would be happy to speak about this further offline as well. And just it maybe not even as in a specific to that family, but in a general sort of situation, because if they're encountering this, there's obviously others that are as well. So I'd be more than happy to take this offline as well, as you had sort of mentioned, but that's all I have to say.
Thank you very much.
Madam Chair, next to speak is Alexandria Liu.
Thank you. Ms. Liu, you are muted. I still don't hear you. I see that you're still muted. Maybe what I would propose, since I don't see the unmute coming off, maybe we'll just give you a moment. Alexandria Liu, is there anybody else whose hand is up at this time? Ms. Fawcett?
No, Madam Chair, there are no further hands, just Ms. Liu's.
Okay, I have determined I will read out the questions from the correspondence that we received. I do want to point out that when we do get correspondence like this, we don't necessarily ask the questions during our meeting, but they would be responded to by our city clerk. But I will go ahead and pose them now, and then we'll see if Ms. Liu is available following that. So the first question was, with regards to the RGI housing waitlist, why isn't a diagnosed incurable illness of the brain or brain injury not considered a priority to be moved to the top of the list? And then question number 2 is, according to your studies, how many homeless people are there in Kingston? And based on that number, how many units do you intend to make available in the next year? Mr. Grange, I see your hand, and I believe I had also seen Ms. Nordegraff's, but I still see Mr. Grange's at this moment, so we'll move forward. Thank you.
Thank you, Madam Chair, for the questions. The first question regarding the RGI waitlist, I guess the reason being is that there is not a priority status for anything urgent medical under the City of Kingston's waitlist, centralized waiting list. So currently the city has the wait list with priority for special priority for victims of domestic violence or human trafficking. And we will be looking to expanding that as part of our ability as local ability as service manager to increase that. And we are doing some research on that now for reinstating a homelessness priority. But currently we do not have any priority on our wait list for urgent medical. And secondly, the second part of the question, I believe it was stated earlier in the presentation that currently we do have 179 individuals experiencing homelessness within our community. And I believe it was asking how many affordable housing units will be coming online in the next year. Is that correct?
And based on that number, how many units do you intend to make available in the next year?
I don't have the specific number in front of me. I can speak to a few initiatives that we have on the go or builds that we have on the go at various stages of development. Kingston-FRON Housing is 27 Wright Crescent, where there'll be 40 units coming on board early next year, I would say, with 23 of those being affordable. 1316, 1318 Princess Street. Again, it's a partnership, or two separate buildings, one Kingston-FRON Housing Corporation, the other Kingston Cooperative Homes. There'll be 90 affordable housing units split between those buildings. That they will not be online in 2021, or it's unlikely, maybe later towards the year, end of the year. 44 Albert Street, supportive transitional housing housing for youth through home-based housing. There'll be 48 units there. There's a development with the Martin Group currently proposed for 28 affordable housing units. We have 113 Lower Union Street, which will be coming online hopefully towards the end of this year for 19 supportive Indigenous supportive housing units. And then that's an acquisition that the city made last year, and that's a partnership with Tipi Moza Urban Native Housing Corporation. And then lastly would be 805 Ridley Drive, which we acquired, which is currently being used for temporary shelter. The west wing is being used for the Kingston Youth Shelter. But there are plans and hopes to expand on that footprint and get the east wing of that building up and functional for some form of supportive housing within the next year. And that all ties in as part of Tracy's presentation at the beginning, where she spoke to the Rapid Housing Initiative and the $7.4 million that were allocated to the city under the municipal stream. So tight timelines to get something occupied within 12 months. So we've identified a short list of properties that can accommodate that. So all of those would equate to about 242 affordable housing units over the course of the next several years coming online.
Thank you so much. And so, Ms. Fawcett, do we know if Alexandria Liu is available? We give that another try.
Madam Chair, we can definitely give it another try and ask if Ms. Liu is able to unmute.
Can you hear me?
Yes.
Okay, when I unmuted last time, I'm on my phone, so the app crashed, and then that was just very embarrassing. But I just have one question. It's just like very straightforward. But how many rent geared to income units do we have in Kingston? And how many do we plan to have by the beginning of winter, like before all the storms and stuff hit? And then what's the plan for 2022 for adding rent geared to income units specifically?
Thank you. Mr. Grange, over to you.
Thank you for the question. I'm sorry, just to clarify, was the question how many RGI units we have within the system, not how many are on the wait list, if I understood that correctly? We do have
how many units are available like within the city? Like how many apartments, whether they're taken or empty, like how many
Okay.
do we have, and how many are we going to add?
So the city, in our role as service manager, we are given a mandated number through the Housing Services Act and the provincial government to maintain 2003 rent geared to income units. And they are administered through 16 social housing providers, as well as some local portable housing benefits that a new program that we initiated about a year and a half, maybe 2 years ago. The RGI program is a program in itself where you cannot just enter and offer RGI units. There's affordable housing, which can be lowered to affordable rates, 60% of CMHC, 80%, even lower if you can make your finances work for the viability of a build. But in terms of traditional RGI units, we are awaiting some legislation changes from the provincial government. It's called Bill 184, strengthening communities, and I'll probably get it wrong, I apologize, but it's Bill 184. And what they will be looking at is looking to expand on the RGI program and have it entice private developers and private landlords to enter the system, as well as giving the option for providers who are currently offering RGI to exit the system. So currently the Housing Services Act mandates that they must maintain and offer RGI units. But Bill 184, when the regulations come into effect, which we do anticipate to be in 2022, we may see an increase in RGI units within the local context of Kingston and Frontenac. But until those regulations come out, it's uncertain at this time. But we are mandated at current time to offer and maintain 2003 RGI units.
Thank you. Did that help, Alexandria?
Yeah, that was great. I'm just wondering if it's a minimum of 2003 rent geared to income, like whatever that number was, if it was a minimum of, or like that's the maximum that the city can have. And then that's it. That's my question.
Thank you. And through you, Madam Chair, I'm happy to jump on that one because I know there's always a lot of conversation about RGI and affordable housing and supportive housing. And there's a lot of different kind of types of programs and initiatives across the housing continuum. So it certainly is a minimum. So we are legislated to have a minimum of 2003 affordable housing. Sorry, so now I'm doing it, RGI units. So the one thing though, and in addition to the great explanation that Mr. Grange has provided, the cost for RGI units are mainly municipal. So, and we're just, preparing for our 2022 operating budgets. And maybe some of you, I think Ms. White was actually at the budget engagement session, I believe a few weeks ago. The reality of RGI units is that they're, especially when they're bricks and mortar, they are quite expensive. On average, we have about a $12 million budget for our RGI portfolio every year in operating dollars. So what we're trying to do is actually, instead of trying to add more RGI units, is look at other more like affordable or quote unquote kind of better ways to come up with housing solutions. For instance, through the portable housing benefits, which also would count as potential RGI, or for instance, what we just discussed with the housing first approach, having rent allowances for people that may just need that difference between their potential shelter allowance and their the cost of their living. Again, this is all in the reality of the market that we're in and the housing realities. But so it's not as, I know a lot of people are asking us why the city is not adding more RGI housing. We really want to look at, how do we add housing solutions that are affordable and are also, I think, sustainable from a financial way, because all of this would, again, be an ongoing operating costs on our municipal budgets, and we can potentially look at other ways. So just wanted to add to that.
Thank you. Ms. Fawcett, did we have anyone else from the public?
Thank you, Madam Chair. There are no further hands.
Okay, great. So we will move on from there. Thank you, everybody, for your questions, and as well to our staff, thank you for your responses. So we'll move forward now to item 8, motions. So from the committee, there are no motions listed on the agenda. We'll move over to number 9, notices of motions. There are no notices of motions listed on the agenda. Are there any intents to bring forward a motion at the next meeting? No. We'll move over to other business. We do have the one other business that I had added earlier in our agenda, which is just myself and my announcement. So over the past few weeks, there have been increased reports in the media regarding the operations of the Kingston-Frontenac Housing Corporation, and some committee members have expressed a desire to receive more information on the issues that have been raised. Staff have received a request from Mary Lynn Cousins-Brame, CEO of Kingston-Frontenac Housing Corporation, to appear as a delegation at the upcoming regular meeting of the Housing and Homelessness Advisory Committee on September 9th in order to provide information to and answer questions from the committee. So I wanted to make that announcement for September 9th. We'll move over to correspondence. We did have one correspondence, which I did take care of asking those questions. Thank you for that correspondence. And the date of our next meeting for this Housing and Homelessness Advisory Committee will be Thursday, September 9th, 2021 at 1 p.m. And we then will move into adjournment. Can I have a first to adjourn? Thank you, Ms. McCarty. Second, please. Ms. Everett, thank you. And all in favor? Perfect, thank you. That has passed. Always the first one to pass. And with that, my phone started ringing. Thank you, everybody. Have a great rest of the day.